Helicobacter pylori. What is bacteria? Bacteria are small living cells that can be found everywhere. Some bacteria are good for us, but those that can cause an infection or cause us to become sick are bad for us. What is H. pylori? H. pylori is a bacteria called Helicobacter pylori. It is a type of bacteria that infects or gets inside the GI tract. The GI tract includes the mouth, stomach, and intestines. H. pylori grows in the stomach and if left untreated can lead to other diseases that affect the stomach. This disease affects more than half of the world's population. Signs and symptoms. While some people have no symptoms, other people may experience gastric reflux or heartburn, upper stomach burning or pain, nausea and vomiting, burping, bloating, and loss of appetite. What can happen without treatment? H. pylori can cause many health problems when the infection isn't treated. This includes pain in the upper stomach, like abdominal fullness, heartburn, nausea, vomiting, and belching, gastritis, or an inflamed and painful stomach, GERD, which is a disease that causes stomach contents to move into the throat and causes heartburn, or gastric/stomach cancer. Health problems that aren't as common but still may occur include other cancers and infections not related to the stomach, problems with insulin working for diabetic patients, heart and breathing problems, liver and gallbladder disease, and problems for pregnant women like increased morning sickness, growth problems with the baby, and high blood pressure during pregnancy. Transmission. H. pylori spreads from person to person by saliva or feces/poop particles that enter the mouth. People who also work in close contact with animals such as horses also have an increased risk of getting H. pylori if hand washing isn't performed because this bacteria can live in the horse's stomach. Eating contaminated food or food that isn't properly prepared, drinking from an unsafe water source, and not washing your hands after using the restroom or before eating also increases your risk. How to lower your risk. Wash your hands after you use the restroom, after coming into contact with animals, and before you cook or eat food. Make sure to wash fruit and vegetables, cook your food properly, and don't eat raw or undercooked food. Only drink from a safe, clean water source. Think before you share food or a drink with someone who may be at risk for contracting H. pylori, like anyone coming from a different country or visiting a different country. Also, including items in your diet such as broccoli, green tea, red wine, licorice, honey, and probiotics can help protect the stomach. How to wash your hands properly. First, you wet your hands. Second, add liquid soap. Lather and scrub for at least 20 seconds. Rinse for 10 seconds, and then dry your hands, making sure that you turn the water off using the paper towel. Don't forget to wash between your fingers, under your nails, and at the top of your hands. Getting tested. Testing is recommended for anyone who has or has had stomach ulcers, stomach cancer, or signs and symptoms associated with H. pylori. There are several tests to check for an H. pylori infection. Some include a blood test, which is a finger stick to check for the bacteria, the breath test, which is where you drink a solution and blow into a bag to see if the bacteria is present. There is also an endoscopy, which is a small camera that is put down the throat to view the stomach. You can ask your healthcare provider about all of the options for testing. Treatment. H. pylori is a curable disease. If it is diagnosed early, it can be treated without causing long-term health effects. If you test positive for H. pylori, treatment includes an antacid, which will reduce the amount of stomach acid produced, making the antibiotics more effective and will also decrease inflammation or irritation in the stomach, as well as 1 or 2 antibiotics to get rid of the bacteria. This medication is taken for 10 days to 2 weeks. Remember, always wash your hands, cook food properly, drink water you know is clean, get tested if you have a history of stomach ulcers or any of the signs and symptoms associated with H. pylori, like gastric reflux or heartburn, upper stomach pain or burning, nausea and vomiting, burping, bloating, and loss of appetite.